In the intense world of medical emergencies,
one patient, 3 times stab wounds.
there's nothing more extreme than a code red.
This is a 2-car RTC.
That's correct.
It means there's an immediate threat to life.
Got 1 male still trapped in the vehicle.
In the West Midlands, a highly specialist team are on call 24/7, ready to race to these major traumas.
ETA 4 minutes.
By road and air,
03, we are lifted from Cosford.
responding to the most severe 999 calls,
Open up the Lucas device over there for me.
day and night.
All right, well done.
From car crashes
Just need to check.
to stabbings.
We're going to put some oxygen on your pals.
Here, where time is critical, lives will be saved. On roadsides, in back gardens, and inside homes.
Okay, coming off the chest.
These emergency doctors and paramedics use cutting-edge trauma techniques and surgery normally only seen in operating theatres to save people from almost certain death.
Sorry, mate.
I know, mate. I know. We're going to sort you out.
Filmed over 2 months with the critical care team,
Ready, set, slide.
we captured every vital second as these specialist crews work to save lives.
On roll. Ready, steady, roll.
Tonight, a teenager is bleeding to death from a stab wound.
Okay, put a direct on there then.
Don't fight, don't fight. I know it's scary.
An accident with an angle grinder,
Is it pretty bad? Okay.
He hasn't seen it.
Okay. All right, bud. All right, bud.
an elderly man with a serious head trauma,
Yeah, you've taken a bit of a beating, haven't you? I think the road's won this time.
and a woman has a life-threatening seizure.
Emily, you're going to look after you, okay?
Ambulance service, patient breathing.
He's come off his push bike. He's unconscious. He's breathing. All his teeth are gone and everything. He's in a bad way. His face is at the road.
And does he seem to be taking regular breaths?
He's breathing very, very fast.
Is the patient in the road?
He's in the road, yeah.
How old do you think he is?
I'd say he's in his 60s. Not tall as teeth, certainly.
We've got an ambulance en route, okay, so just keep your eye out for the ambulance.
I will do, yeah.
A local ambulance has already been dispatched to the scene of the accident, but there's a high chance the man has suffered paralysis or brain damage, and his life may be at risk, so critical care backup is needed.
It's coming through with
We'll get back up.
the male in his 60s that's come off the motorbike.
60, that's what we see. Thanks very much. I think it'll be about 8 minutes of it.
Critical care paramedics Will Meadows and Colin Apps deal with life-threatening emergencies on a daily basis. Their advanced trauma training gives the most gravely ill the best chance of survival.
Yeah, the information's come through that he's unconscious. That would suggest that he may well have serious injuries, including injuries to his head.
10 minutes after receiving the emergency call, they are on scene. The local paramedics have taken the injured man into their ambulance.
Sorry, guys. My name's Will, one of the critical care paramedics.
I'm Joe.
Paramedic Joe quickly briefs Will on the details of the accident so he can begin his assessment.
Been travelling on his motorbike, no helmet. Push bike, sorry. Yeah, apparently the front wheel has locked up.
Yeah.
He's gone over the handlebars and full impact on the front of his face.
Okay.
73-year-old Fred, a retired crane driver, was riding back home after visiting his 99-year-old mother when the accident happened.
Bystanders state that he didn't move to start with, so we're querying a period of unconsciousness with him. On our arrival, he's sat up, he's talking, he's fully orientated, he knew where he was, but he couldn't recall the incident of what had happened.
Okay.
Fred's injuries are so extensive, he needs urgent hospital treatment and a brain scan.
We've got a good 2-inch laceration above his right eyebrow. Initially, they said that he wasn't moving.
At the very least, he has concussion, but the memory loss and blackout could be the sign of a much more serious brain injury. It's Friday night, and Dr. Adam Lowe, a consultant anaesthetist at Birmingham's Queen Elizabeth Hospital, is getting ready to start his shift for the critical care team. Tonight, he's paired with full-time critical care paramedic Rob Davies.
It's very hard to predict on any day of the week, but Friday night, people are out and about. Social nights, there'll be more people in the city centre. We may well be busy in and around Birmingham. So yeah, we just get our checklists done, make sure we've got all our kit ready. Hopefully a nice, gentle evening.
12 minutes later, an emergency call comes through to the base.
Okay, thank you. Good evening. Take you on the job, please. It's going to be a 21-year-old male with a stab wound. The stab wound is 2 inches long on his upper back, query with a knife. It also says on the note, query offender is outside. There's nothing to suggest police are on scene yet.
Last year in the West Midlands, there were nearly 5,000 violent knife crimes. Reducing the number of deaths is one of the critical care team's main objectives.
Whiskey 55, thank you. I'm sure the sector told you as well. Crew is en route. We believe these offenders are outside the property and the patient is inside the property. Details are being passed to the police at the moment. Alright, thank you. Just to confirm, these police are not yet in attendance, so we believe the offenders to be outside.
Hi Nate, that's received. We're about 2 minutes out, so is there an RVB point over?
With the attackers believed to be nearby, the trauma desk instructs Adam and Rob not to go directly to the house, but wait for police protection.
The 2 people are outside who they think have done it, so they're advising us not to go directly to the house. It's that balance, really, isn't it? Because if it's still an aggressive scene or not secure, we don't want either ourselves or other members of the ambulance service getting injured.
5, thank you. Please just spot the power location. Just stand by you and update.
It's 7:38 p.m. Police and ambulance crew arrive at the address, so Adam and Rob get the go-ahead to enter the property, while our camera operator is told to wait outside.
Right.
Oh, all right.
Are you guys on your own?
Yeah.
You are going to need to go to hospital. Let me just see your front, make sure you haven't got any injuries here.
The man is in shock and distressed with a stab wound to his back. It's unclear to Adam and Rob whether or not he knew his attacker.
OK, well, lie down onto your side, then. Lie down onto your side.
This on his left side of his back. We're just going to lift and go around the corner then, yeah? Happy?
But he's lucky. After assessment by the critical care team, it's decided whilst it's a nasty cut, it's not life-threatening.
They're not nice incidents to go to, but we go to stabbings fairly regularly, so it's not a surprise that we're being tasked to a stabbing. Unfortunately, it's one of those things, and living and working in the urban environment, stabbings are fairly common and are quite a significant workload for major trauma centres as well.
In the West Midlands, critical care paramedics deal with around 30 stabbing incidents a week.
All right, mate.
And they don't have long to wait for the next one.
Please reach the ambulance. Is the patient conscious and breathing?
Somebody stabbed him on the neck.
Okay. Do you know if he's breathing?
He's breathing at the moment, yes. He needs the ambulance quick as possible. A lot of blood coming out.
Is the blood spurting out?
Yeah.
It is, my love, okay.
Oh, my God.
Just keep pressing on his neck, my love. We're coming as quick as we can.
Oh, God. I've never seen anything like this. It's getting worse.
Just keep the pressure on that bleed, love. You're doing all you can.
Basically, we're on the way to someone who's been stabbed in the neck, and it's spurting, and there aren't any crews there yet, but they're going to let us know when someone gets there.
The second stabbing of the shift sounds very serious. Spurting blood may mean a major artery has been cut. Adam and Rob need to get there fast, as there's a danger the victim could bleed out and die.
You're clear on my side. They are stopping. Yeah, still stopped.
Police and the nearest ambulance have also been dispatched to the scene. Adam and Rob are just 5 minutes away, but with a serious stab wound, every second counts.
Thank you. Just to keep you aware, we're keep having extra calls on this. I think people are panicking a lot on the scene. The doctor's going on and saying he's still bleeding through towels that are being pressure being applied. There's a lot of blood on the floor, and patients that collapsed the floor.
Yeah, that's great. We're 1 minute out.
A stab wound to the neck could have severed airways as well as arteries. As trauma specialists, it's one of the most challenging situations Adam and Rob can be faced with.
Hi, guys.
Hi, guys. I'm Adam. I'm the doctor on Meadows behind you. You okay? Okay, don't fight. Don't fight.
Adam immediately takes control of the scene, locating and assessing the size and severity of the neck wound.
Can you hear us? Okay.
Right. So quite a lot.
What's wrong with your breathing?
Can we get the trolley?
Okay, guys.
He's bleeding heavily and struggling to breathe.
Okay. Adam, can you see down there?
The victim is just 16 years old.
Ambulance services, the patient breathing.
In 2012, the West Midlands Critical Care Team and Midlands Air Ambulance joined together to create a specialist trauma response unit.
We've got more experience in dealing with patients who are critically ill or injured.
Let's do a few little checks on you, okay? See how you're doing.
38 doctors and 34 critical care paramedics bring hospital-level care to those most in need.
What we provide is to bring an advanced care team to the patient at the roadside.
I'm just going to have a little look at your foot, okay?
Nice deep breath.
Well done.
By focusing on only the most serious emergencies, their enhanced skills and training often make the difference between life and death.
I think they've proved that with a good trauma network nationally, that you're 60% more likely to survive a trauma.
It's very intense at times and demanding, but thoroughly rewarding. I love my job.
Ambulance services, the patient breathing.
Yeah, he's had his hand in a steel saw.
A steel saw?
Yeah, it's gone straight through. Yeah, I don't want to describe it too much.
How far through his hand has the saw gone?
Dan, you need to move your hand, please, because I need to describe it to her. I need to put your hand over your face. Hold on. Oh, very, 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 very bad.
We're getting someone to him as soon as we can. Just keep the pressure on the wound, directly on the wound.
An accident with a power tool can inflict life-altering injuries. An ambulance has been called, but they've requested specialist trauma backup, and critical care paramedic Tom Waters is now en route.
Looks like I'm going to be first on scene, and it's someone, they just said he's cut through his hand with an angle grinder. DIY gone wrong. The benefit that I think my team and myself can go to is we can hopefully make that assessment to really identify what hospital is best for that patient.
10 minutes later, Tom is on scene. The local ambulance crew are already there.
Hello? Hi, you're right. So what's happened?
He was cutting the door frame there and went straight through his hand.
30-year-old bricklayer Daniel was cutting the timber on a workbench using an angle grinder with a 4.5-inch circular blade when he lost control and it sliced through his right hand. His wife Stacey found him and has been trying to stop the bleeding.
Okay, and how bad is it before we have a look at it? Is it pretty bad? Okay.
He hasn't seen it.
Okay, what's your name, sir?
Daniel.
Daniel. Do you live here, do you? Is this right? Okay.
Yeah.
The paramedics have been on scene for 5 minutes. Daniel is in a severe state of shock and close to passing out. They've got him to raise his arm above his heart to try and stop the bleeding.
It's fine. Have you got your trauma pack with you tomorrow?
No, I can go.
Yeah, I think maybe if you're saying it's quite bad, we'll get our bandages just in case. If you hurt yourself anywhere else?
No.
No, so it's just your hand?
Yeah.
Do you mind if I...
Yeah.
This impressive towel you got on here.
It's the second one.
Okay. Okay, so what we'll do, before we open it up, we'll get our bandages just in case.
Daniel's in excruciating pain and can't bear to look at the damage he's done.
All right. Are you all right to come round here and cut his sleeve off? Yeah. I've got some scissors on me, if you want. Yeah. Some quick look. Okay. I know, sorry, buddy. We'll give you some pain relief, but what I want to do is have a real quick look at it first.
Until he can actually see the wound, Tom doesn't know if Daniel has cut an artery or is in danger of losing any fingers. Both require immediate surgery.
Okay. All right, bud. All right, bud.
Did he get himself off the floor and self-mobilised into the back here?
Well, no, we took the stretcher out to him, cleared his C-spine, managed to stand him up and he stood onto the stretcher.
In Walsall, critical care paramedics Will Meadows and Colin Apps have been called to the scene of a serious head trauma.
He's got a full laceration to the top of his lip, complete laceration on his tongue as well, so it's kind of lizard tongue at the front.
Righto.
3 teeth have come out and also laceration to the bottom lip where it's hanging.
Okay.
73-year-old Fred was travelling at speed on his bicycle when he was thrown headfirst onto the road, landing on his face. He blacked out and is now dazed but conscious.
Have we found the teeth, or are they...?
Yeah, we've got 3 of them there, yeah.
OK, so there's 3 missing and you found them all?
Yeah,
okay.
the ones at the back look quite broken as well. There's nothing there I can see that's gone through the palate at the top.
Mind just opening your mouth there, sir?
Stick your tongue out again, Fred, for me.
Will checks Fred's mouth to be sure there is no obstruction to his airway or damage to the roof of his mouth.
How are you breathing? Is it OK?
Yes.
Yeah?
Yeah.
OK. Are you in much pain at all?
No, no pain. Just a little bit of bruise there.
Yeah, try not to touch your face there, sir, OK? Because we don't want to contaminate that, but...
Yeah.
Yeah, you've taken a bit of a beating, haven't you? I think the road's won this time.
Yeah.
Yeah. OK.
Will is most worried about Fred's unseen injuries. His head took the full force of the impact. Head traumas are very unpredictable, and there is a risk he may have damaged blood vessels that could turn into a more serious bleed on the brain.
I don't know what happened, actually.
No, I don't think you're going to have the answers either, Fred. Accidents happen really quick, don't they?
Are you on any blood thinners at all?
No.
No?
No medication, no medical history at all.
medication.
Is it still bleeding inside your mouth?
Yeah, try not to touch it though, Fred.
Yeah? Filtrum, you know that bit between the top lip and your nose? That's split vertically.
Will calls into the trauma desk to alert them that Fred is likely to need reconstructive surgery on his face.
He's got split lips. He's had 3 teeth knocked out. They're all accounted for. And his tongue's been split as well, sort of in the middle, and quite aptly described as lizard tongue. Got a pulse rate of 98, sats of 96%, T15, and a rest rate of 80. C-spine is clear.
Part of Will and Colin's expertise is to ensure Fred is sent to the appropriate trauma centre that can treat all of his injuries.
OK, well, I think he's probably going to be needing some max fax specialist.
Fred, what we're trying to figure out is where we're going to take you, where's best to get your face repaired, all right? We're just going to figure that out at the minute, OK?
The Queen Elizabeth Major Trauma Centre in Birmingham has specialist maxillofacial surgeons who can assess and treat Fred's head wounds.
Not surprised.
That lip damage, that filtrum damage, that's all from the front teeth, isn't it? Where he's pretty much kissed the floor, hasn't he? So.
You're a tough bloke, Fred.
Oh, he sure was.
Fred, I'm going to ask you again, sweetheart, do you want any pain relief?
Yeah, just a bit of painful here.
Do you want pain relief for him?
No,
Because
no,
we can
no.
give you some-
No, no.
No?
No, it's all right.
Fair enough.
Try not to keep dabbing it, baby.
Amazingly, Fred seems to be untroubled by his injuries. He wasn't wearing a helmet. If he had been, it may have deflected some of the force of the blow and given him more protection from serious long-term brain injury.
If you're getting blood into your mouth, just let it dribble into there. Try not to force the spit, just let it dribble out.
As it stands, he will need a brain scan to rule out any potentially fatal clots or bruising.
How fast do you normally cycle there, Fred?
Oh, no.
It's not got a battery in it, has it, your bike?
No. It's an
So just-
ordinary racer.
A racer?
Yeah.
Yeah, on his own.
Yeah.
So, yeah.
40 mile an hour then. Head down.
There is still. Trouble desk is going to give them a heads up, so you can be seen sooner rather than later. And if they can't manage Fred, then they'll get him transferred to the QE where you can go. All right.
Lovely.
We'll get out of your way.
I don't know
Okay.
what happened.
Take care. Have a nice day.
All right, Fred. You mind how you go, okay? Next time, wear a helmet.
Yeah, I don't know what happened.
All right, guys. Thanks very much. Cheers.
It's a 6-minute journey to hospital. Happy that Fred is stable, Colin and Will leave him in the care of the paramedics, freeing them up for their next emergency call.
Yeah, they seem to be
stoic.
Yeah, very good pain threshold. I would have been crying.
Ambulance service, is the patient breathing?
She's having a fit.
Has she been diagnosed with epilepsy?
I don't know, I'm not sure, sorry.
Okay.
She's fitting really badly.
6-2, we're showing about 5 minutes away. It's reports of a 39-year-old female who's having a seizure in the Merry Hill shopping centre. She's been having headaches and now today she's gone on to have a fit.
A woman is in the throes of a potentially life-threatening seizure. The critical care team are urgently needed and critical care paramedics Mike Andrews and Pete Edwards are en route.
Just advise that she's actively fitting.
That's all received, many thanks.
Seizures are caused by surges of electricity in the brain and are an indication of epilepsy, a neurological disorder that kills 1,000 Britons every year.
Oh, there you go, visual. I'll get the red bag. Do you mind grabbing the drugs?
In the shopping centre, a building society clerk has suddenly collapsed at work and started fitting uncontrollably. Her shocked colleagues called 999. An ambulance crew is already on scene.
Hello, how you doing? All right. How's it going? I'm Pete. I'm one of the paramedics. This is Mike.
39-year-old Emily is lying unconscious. The ambulance paramedic who has been looking after her updates Pete on her condition.
She was fitting for about 15 minutes before we got here.
Yeah, okay.
She's fitted for 2 minutes 54 while we've been here.
Yeah.
We don't know anything else.
Okay. No history of head injury today or anything like that. So we just got migraines recently, had a seizure today. Just today. Okay, all right.
Can you squeeze my hand, sweet? Can you squeeze my hand for me?
As part of his assessment, Pete needs to know if Emily's ever been symptomatic before.
So she is an epileptic, is that what we're saying?
When she was little, she did used to have it, but not recently.
Right, okay, so she hasn't had a seizure for a while, but she has had them in the past.
Probably about this time last year. This is the last one.
Okay.
People's jaws often clamp shut during seizures, which restricts the airways. If starved of oxygen, Emily could go into cardiac arrest. So Pete needs to administer diazepam, a muscle relaxant, to stop her convulsing.
Should we put a bandage on so we don't lose the IV access? Are you able to, is that all right? I'm just thinking that if she starts fitting again, we might get pulled out, mightn't it?
Worried that Emily may start thrashing around when she fits, Pete needs to be sure the IV line is securely attached.
I think now we've got IV access. If she starts fitting again, we'll go to Azamols, yeah? Is that all right? Is that what you're thinking? Yeah. And BM and everything's all right. I think the best thing, we'll get a stretcher, get her onto the vehicle. Yeah, OK.
Pete wants to get Emily to hospital, but she takes a turn for the worse.
Is that wound or is that dressing? What's that there?
Dressing.
In Birmingham, trauma doctor Adam and critical care paramedic Rob are trying to save the life of a boy who's been stabbed in the street.
Can you see? Here.
Okay, so we've got one behind me here.
Yeah.
Is there anything at the front of the neck?
The 16-year-old has a deep wound to his neck and it's spurting blood.
Okay, put a direct on there then.
He's already lost about a litre of blood. The human body contains 5. Adam knows he can't afford to lose much more before he passes out and goes into cardiac arrest.
Right, mate, have a look.
What's gonna happen now? Listen, what's gonna happen? Don't worry about them. Look at me. What's gonna happen? I'm gonna get you onto an ambulance, okay? Let me just see if there's any blood in your mouth. Open your mouth wide. Good lad.
Nothing.
Pressure from his wound is causing the boy to panic and restricting his breathing.
Just calm your breathing. You're doing absolutely fine. I know it might feel hard where you've been injured. Okay, it's away from your voice box. I know it's scary, okay, but you're doing fine. I'm pushing on the side of your neck.
They need to get him to hospital for emergency surgery to repair the blood vessels in his neck, but moving him risks tearing the wound and sudden catastrophic blood loss.
Not time.
Okay.
Okay.
It's all right.
Listen, have you got phlegm at the back? Just spit it out, mate.
Just spit it on the floor, go on.
Adam needs to keep the boy calm while maintaining a constant life-saving pressure on his neck to stop the bleeding.
Do you feel able to stand, mate?
Yeah.
Okay, right.
Good lad. Yeah, go on.
I'm not going to let go because I need to put that pressure on, okay? Hold on, guys, hold on. I need to keep the pressure on.
Can you get around, mate, to you? So, bump there, that's it. Lay down on the bed.
Okay.
Once on the stretcher, it's now a race against time to get him to hospital.
Right, mate, you okay? Can we have our bag on the back? Yeah. My hands are going to be a bit tied up just to keep that pressure on. So let's get some straps on. How are you doing? All right, well done. Okay. I need to keep to the QE. Yeah, I need to keep my hands on to stop the bleeding, okay? Because you have bled a reasonable amount. Any medical history I need to know about? Asthmatic? Sickle cell? No? Are you allergic to anything? Right. Okay. Leave a little bit of room for me. That's it. Well done. Good, so a bit brighter in here.
On the ambulance, Adam and Rob can now fully assess the damage the knife has done.
Hi, mate. You're right.
He's bled a fair bit of volume and he's still bleeding past my hand, so I need to get a grip on where that's coming from. Tacky 130, active from the back. It's not anywhere major vascular, but it is actively bleeding. Can I have that Celox? Because I can see where that's coming from now.
Hold on, Adam.
Using a gauze coated with a blood-clotting agent, Adam manages to stabilise the wound as much as possible to prepare for the journey.
Nice and steady.
All right, buddy. We're going to sort you out. We're going to take you to the QE. Good work.
You're doing great, mate. You're doing great. Have you got pain anywhere else? No. Okay.
12 minutes after they arrived on scene, Adam and Rob are en route to hospital.
Okay. Rob, do you want to carry on looking at access for me?
Yeah. Give us that arm.
The boy is in such a critical condition, they both need to travel with him, continuing emergency care throughout the 6-mile journey.
I'm going to do the TXA. Yeah. You can do a set of obs.
Arriving at hospital 11 minutes later, Adam delivers his still critically ill patient to the waiting emergency staff.
That's one of the things we are there for. We will just bring some advanced decision-making in terms of which hospital we're going to. We won't go to the nearest hospital. We will travel a little bit further with an unstable patient to get them to the right major trauma centre.
Let's get the stretcher, let's get something to get her out and get that sorted, all right?
In Dudley, critical care paramedic Pete Edwards is fighting to control the seizures threatening 39-year-old building society clerk Emily's life.
Emily, we're going to look after you, OK? Let's get a BM done, make sure her blood sugars aren't low. We've got her on oxygen, OK? If she starts really fitting again and it's prolonged, we'll give her some Dazamols, and obviously we'll just have to then do a bit of airway maintenance in case she goes. And we'll just pop the SATS Pro back on, just keep her eye on her SAT.
Whether or not we have the condition, 1 in 20 of us will suffer a one-off epileptic seizure at some point, and they can be fatal.
Just have a look at that, Mike. Make sure I've drawn up the right thing. It's Diazomols and it's in date. Okay. Yeah, 10 milligrams in 2 mil. All right.
9 minutes after the last one with a sedative anti-seizure medication on board, Emily's condition seems to be improving.
Pop her onto her side just for, like, into the recovery position. Yep.
She is more alert, and her convulsions appear to have subsided.
Yeah, super. Yeah, no, that's fine, that's fine.
But Pete's critical care training makes him ever watchful.
And even in the most severe cases, despite us giving anti-seizure medication, the patient continues to fit, and this can become time-critical emergency.
With the sedation, there's a risk her body could struggle to breathe.
If we don't manage the airway and the brain is starved of oxygen, there is brain damage, brain death, and ultimately cardiac arrest.
The priority now, get Emily to hospital.
Emily, my love, can you hear me okay? Listen, we're going to get you up the hospital and get the doctor to look at you. We've just got to get you onto the stretcher now. I'm just going to pop the oxygen off for now. I'm going to sit you up, nice and steady, just bend in the middle. OK. Right, Emily, lean back against me and just have a moment, because you've been lying down, all right? All right? Do you know where you are? No? It's a bit strange. We're going to help you. All we've got to do is get you onto him and get you nice and comfy. OK, so we'll go on through. We'll have a little rock. So, 1, 2, and 3. Up we go onto our feet. Lovely. Super. Emily, swing your legs up. Let's get you comfy. That's it.
The ambulance will take Emily to the nearest emergency department.
Thankfully, on this occasion, she appears to have made a quite rapid recovery. Some patients will just have one seizure, make a recovery, and they're absolutely fine. But we do go to these patients who recover, and then sometimes it might be minutes later or even seconds later, they'll have further seizures, and this can be quite complicated. And those sort of patients, we get them to hospital where they can be assessed further sometimes, just to make sure there isn't anything more untoward going on somewhere.
How bad's the pain out of 10?
Okay.
In Stourbridge, critical care paramedic Tom Waters is trying to assess the damage to Daniel's hand after he sliced into it with an angle grinder.
Okay, all right, bud. All right, bud. Turn your arm round. All right. You feel me touching you here? Okay.
Daniel has a 3-inch wound, 1.5 inches deep between his thumb and forefinger. Once the towel is removed, it starts bleeding freely again.
Wiggle that thumb for me.
Can't.
Okay, all right. What we're going to do, buddy, is we're going to clean it up. It's in the corner bit of your thumb. That make you obviously know where it is.
Lucky for Daniel, the blade stops short of the bone.
Straighten that arm out for me. I'm sorry. Well done. I just want to straighten this hand for me.
Daniel is fortunate. All his fingers are still there, and there's no obvious nerve damage. The wound will now be cleaned with saline solution and dressed to immobilize the fingers and help stop the bleeding.
It's just obviously in the crease of his thumb. He's got good circulation here. Yeah, and he can feel me touching his hands.
Yeah.
And it's, yeah, so I think it's just more soft tissue.
Yeah.
We're going to cover it.
Yep.
And then I think we'll...
If we just take a picture. So
yeah, that's fine.
One of the paramedics takes photographs of the wound to show to the hospital doctors in A&E so they can assess whether he needs immediate surgery.
Yeah, nice and still.
All right. Keep still for us, buddy. As soon as you've done this, we'll get you some pain relief.
Last year, almost 5,000 people were admitted to hospital following accidents with power tools.
I'm going to bandage that up. Yeah, it's going to be a little bit painful for a little while.
I'm sorry, mate. When you're working next, don't say Monday.
Yeah. It won't be.
I think it probably feels and looks worse than what it is.
Yeah.
I think it needs to be cleaned, it needs to be x-rayed,
Yeah.
and it needs to be stitched back together.
Cheers for that. I don't know how you lot could look at it, to be fair.
It's all right, mate. There you go. Just take your time, nice and slow. With no rush. Feel right? Let me just walk behind you.
With Daniel now recovered enough to walk out to the ambulance, Tom is happy to leave him in the care of the local crew for the journey to hospital.
He'll go to the local A&E where he'll get it cleaned. He most likely will have some form of antibiotics and an X-ray, and then it'll be decided onto there if he needs specialist care to treat that part of his hand. It's very much in the forefront of our minds that we want him to get the best care for his hand. So he's a young chap, he's a labourer, we obviously need to get him back to work as soon as possible. It could have been a lot worse. It's still going to be a really painful injury, but hopefully he'll have a really quick recovery.
One of the trauma team's key areas of expertise is paediatric emergency care. Being called to a critically ill child is every paramedic's worst nightmare, so they need to be able to rely on a high level of skills and training.
Ambulance service, is the patient breathing?
Yes, he is.
Are they conscious?
Yes, he is.
And what's wrong with the patient?
He's just gone completely down the stairs.
He fell down the stairs?
Yes, he's two.
Top to bottom, was it?
Literally, yes. I think his wrist might be a bit broken.
Oh. And did he bang his head, or has he landed on his
I'm
feet?
not sure. I don't know how. He landed kind of upside down at the bottom.
Six two. I've got you that it's a 2-year-old that's fallen down the stairs. Is that correct, Emma?
That's correct, mate. Yeah, top to bottom of the stairs, there's fallen 3 metres or more. The child's had a head injury. They are conscious, but they've clearly got a fractured wrist as well.
Roger, that's all received. Thanks, Mike.
In Albury, critical care paramedic Faye Pollock is en route to a code red emergency. A 2-year-old child has fallen 3 metres downstairs, landing on his head.
Just confirming that he has fallen top to bottom of the stairs. He's got a head injury and a wrist injury.
An ambulance has been called, but with the potential for life-threatening injuries, the trauma team's enhanced skills are also required.
Obviously, because it's a child and they have their whole lives ahead of them. The last thing they want to do is be fighting for their life or be disabled in any way because of an accident.
3 minutes later, Faye is on scene, ready to be briefed by the ambulance crew.
This is young Josh, 2 years of age. Mum said he's got his big habit at the moment of doing Superman down the stairs. But she's in here and she's heard thump, 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 thump.
Yeah.
I haven't touched him, I haven't done anything. We literally just got here, found out the history, that's it.
Okay, I'll have a chat to Mum initially. Is he acting as normal now? He seems quiet.
Yeah, he's very hyper, Josh is. He's constantly on the go.
Mum Rachel confirms there has been a worrying change in Josh's behaviour. The worst-case scenario is that Josh has fractured his skull in the fall and has a potentially fatal bleed on his brain.
This is almost as if he's either covering his eyes or his arm's hurting. I'm not sure, but this is unusual for him to put his arm across.
No, we can do that with strangers.
So that might be a comfort thing, the fact that we're okay.
Critically ill or injured children can appear to be okay, but then suddenly go downhill.
So the little things like that, only mums know, but it says a lot to us in that
definitely.
He's not photophobic.
Josh, can we put zinc onto your thumb?
No.
Josh needs to go to hospital to be scanned. First, though, Faye needs to take his blood pressure and heart rate, but Josh is too distressed.
He hasn't been sick, has he? He's
No,
not.
no sickness.
No.
If he's gone down the stairs the way he has, you're not going to come down without the mark, are you? No,
we're not
God bless you. It's just because I've not really been able to get too close to be able to really get my hands on, and the only thing I'm doing when I'm getting near him is distressing
Makes him more upset.
At the moment, yeah.
He has also been guarding his left arm in a way that suggests he might have broken it in the fall.
I tell you what, let's see if we can try a little trick. Can I have Mickey a second? Is that Mickey? Mickey. Let me just have Mickey for a second. Let's see. Let's put.
Oh, don't you want to give Mickey?
That's a good sign that his arms are all right. Yeah. You fell for the trick.
Encouraged by Josh's reaction, Faye tries again to attach the monitoring equipment.
Do you want to pick which finger?
Which finger? Should we do it on this one?
Do you want to try?
Should we try it on your foot? Yeah, come on.
But he's not falling for it.
Mommy, do it. Mommy, do it.
He's certainly a good colour in his lips, good colouring in his face. The fact that he's able to understand and say no are all the signs that I think he's probably just shocked himself. Yeah, distressed himself.
To help soothe Josh, Faye wants to administer some paracetamol.
It'll make you feel better, sweetheart. Good boy. Come on, Josh. Okay. Oh, that's it. Good boy. Well done, Mum. No, you've done that before.
Paramedic Nikki has a trick up her sleeve to try and take Josh's mind off his troubles.
You're going to catch him.
Distracted by the bubbles, the paramedics manage to attach the oxygen saturation and heart rate monitor to his toes.
Yay, well done, Josh.
Should we see if we can get him over there and you can catch him? Can you reach over that way? Oh, well done.
That has worked a treat. Well done, you. I like footballs. Yes, it's about amusement. Doesn't matter about the patients. Apparently the wounds on his legs are from previous Superman impressions, yeah?
It must hurt, but it doesn't stop him.
It's excitement though, Dad. It's the excitement of going head first down the stairs.
Josh looks to be making good progress, but Faye still wants him to go to hospital to be checked over by the emergency doctors.
Mum, is there anything that you need?
No.
Immediately.
I've already done it.
Oh, you're, oh, God, wow. That is one prepared, Mother. Bye-bye.
Thank you.
You take care, Mum. Well done for keeping you cool.
She leaves him in the care of the ambulance crew for the 6-mile journey to Birmingham City Hospital.
So you're never quite sure what injuries they may have, and as you saw, he's so scared and he's so anxious, the fact that he's got 3 strange people in the room. He immediately curled up into a ball on Grandma's lap. So there was no way that we were going to be able to assess him for his injuries properly there until the paramedic got an absolute beauty with those bubbles.
In the intense world of medical emergencies,
1 patient, 3 times stab wounds.
there's nothing more extreme than a code red.
Accident is a 2-car RTC.
That's correct.
It means there's an immediate threat to life.
Got one male still trapped in the vehicle.
In the West Midlands, a highly specialist team are on call 24/7, ready to race to these major traumas.
ETA 4 minutes.
By road and air.
03, we are lifted from Cosford.
Responding to the most severe 999 calls.
Open up the Lucas device over there for me.
Day and night.
All right, well done.
From car crashes
Just need to check.
to stabbings.
We're going to put some oxygen on your pal.
Here, where time is critical, lives will be saved. On roadsides, in back gardens, and inside homes.
Okay, coming off the chest.
These emergency doctors and paramedics use cutting-edge trauma techniques and surgery normally only seen in operating theatres to save people from almost certain death.
Sorry, mate.
I know, mate. I know. We're going to sort you out.
Filmed over 2 months with the critical care team,
Ready, set, slide.
we captured every vital second as these specialist crews work to save lives.
On roll, ready, steady, roll.
Tonight, a man collapses in a Wolverhampton churchyard.
Stand clear. 3, 2, 1. Back on the chest, guys.
A police pursuit ends in a major RTC.
He's been ejected from the rear in a car crash.
A pensioner falls down a flight of stairs.
Joe, is it hurting anywhere? I'm pushing here. Yes. Whereabouts?
In your neck.
And a motorcycle crash
That's it, Cameron.
leaves a teenager in agony.
There's lots of things, elements to our job. Save lives, wash cars.
Critical care paramedic Faye Pollock is beginning her first 12-hour shift of the week. It's essential that the emergency car, which is charity funded by Midlands Air Ambulance, is kept in tip-top condition.
The public have paid for it, so actually it deserves to be well looked after and clean and presentable, really. We are a professional body, so therefore we have to have professional vehicles. And it takes 10 minutes to wash a car. But it's freezing, it's so cold. Oh my God, I can't feel my fingers.
Ambulance service. Is the patient breathing and conscious?
Yeah, he's been knocked out. Just a motorbike and car collision.
So it's a car v motorbike. Okay. Can you see any obvious heavy blood loss?
No, I think the motor broke his leg.
I just need to try and rule out any life-threatening shock, okay? Does it look very pale or grey to you?
Yeah, we got enough gates on the front.
All right. The help's already been arranged. When on blue lights and sirens, okay?
An ambulance has been dispatched, but critical care paramedic Faye is also urgently needed.
There's an ambulance crew in attendance with him. They say that he has got, thank you, sir, a broken leg. He's in quite a bit of pain. They've maxed out on the amount of analgesic drugs that they can give him. So they have requested me to go and give some enhanced care. But if the impact was enough to break his leg, then there might be some underlying injuries that we haven't yet identified, so.
More than 300 motorcyclists are killed and over 5,500 seriously injured every year on Britain's roads.
Ah, yes, I see blue lights.
Faye arrives 17 minutes after receiving the call.
Hello, how you doing? Oh, he's a motorcyclist versus a car, yeah. Cameron, you say? Cameron, listen, my name's Faye, I'm with the Midlands Air Ambulance, okay?
On his way to work, 18-year-old Cameron's motorbike collided with a car. He was thrown off the bike, landing 15 feet away on the grass verge.
This is where you landed?
Where I landed, I flew straight over the bunny.
Okay.
The ambulance crew has already reported that Cameron has a broken leg.
Okay.
Gram of IV paracetamol.
Yeah.
He's on his second bottle of Entinox, but he's in absolute
agony. Okay.
You know, we can't even get the splint on him. That's why we've asked for a little bit more help.
No problem.
The pain relief given to Cameron by the ambulance crew isn't strong enough. But Faye's special training means she can administer more powerful drugs only carried by the critical care teams.
I'm just going to take your t-shirt off. I know it's absolutely freezing, mate, but you're not bothered. I am.
Before using it, Faye checks Cameron for any other serious injuries.
Any pain in your neck?
No, nothing.
No, okay. Nothing in your throat here?
No, nothing.
Okay. Any pain in your tummy?
No, nothing.
No, okay. Any pain in your shoulders up here?
No, nothing.
No. Wiggle your right hand for me. Brilliant. Wiggle your left hand for me. Well done. Can you change your bottom cheeks together? That'll do. Okay. It's all this pain in your leg. Okay.
Yeah, just my right leg.
Cameron has broken his right thigh bone, the largest bone in the body.
Which leg am I touching, left or right? Good man.
There is also the risk Cameron could have broken his pelvis or damaged his spine, which could cause paralysis.
No pain as I'm touching down your back?
No.
No, okay. Okay, wiggle your toes. Good man.
Thankfully, Cameron's spine doesn't appear to have been damaged. Faye can now turn her attention to his broken leg.
All right, Cameron, I'm sorry. It's not helping the fact that it's so bloody cold. Could you plug that into your
Oh my God, my leg's really gone out. Hang on, stop putting pressure.
We're gonna help you now, Cameron. Sorry, my friend.
Faye wants to get Cameron to hospital, but he's in too much pain to be moved.
At the moment, the reason why it's so uncomfortable is because you have broken your leg. Is the two bones are scratching against each other. Okay. As soon as it's in line, you will create your own pain relief because it's back where it should be. All right. It's all set up, isn't it? So if we give him a little shot of ketamine in there.
Straightening his leg is an excruciating procedure, so Faye prepares to give Cameron a powerful painkiller called ketamine.
So Cameron, I'm just going to give you this drug, okay? It will make you feel a little bit sleepy, but it's just so that we can pull. I'm only going to give you a touch so we can pull that leg. The moment we pull it, it'll actually feel... No, trust us. Trust us. 1, 2, 5.
It's essential Faye straightens Cameron's leg as soon as possible. While it's out of alignment, it could be causing internal bleeding with the risk of life-threatening blood clots.
Soon gonna be over, man. Soon gonna be over.
Critical care paramedic Stephen Mitch Mitchell is starting the Saturday shift by making sure his kit is ready for whatever the day brings.
It doesn't look tidy enough for my liking. Everything keeps you on your toes, and you almost have to be a certain character type to do this type of job. I think the weather will keep people indoors today, but we'll have to see.
This is the patient breathing.
I think no breathing. I touched him, but no reaction.
Okay, is he breathing?
I don't think so.
We need to start CPR.
Yeah.
Okay, put one hand in the centre of his chest and lock your fingers together. You're going to keep your arm straight, push down hard and fast. Don't be afraid to push too hard, okay? You're going to go push, 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 push.
Yep, yep.
Say push out loud every time. Push, 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 push. 1, 2, 3. 1, 2, 3. Keep pushing. Don't stop until they tell you to. Can you see the ambulance anywhere?
Yeah, yeah.
The collapsed man who's not breathing is a code red emergency. Local ambulance crews are on scene, and to help with advanced life-saving treatment, Mitch is also on his way.
So it's reports of a 40-year-old male who's had a cardiac arrest, so hopefully we can help out where we can.
With cardiac arrests, time is crucial. When the heart stops beating, no blood is pumped around the body, starving vital organs of oxygen. Every minute without CPR, the chances of survival drops by 10%.
Oh, there, guys, you all right? It's Mitch.
Found my passerby. That's why I was doing CPR, but he said it didn't look that effective, but he was doing his best he could.
The man was found 17 minutes ago, collapsed and in cardiac arrest.
A little bit faster, Chief. Keep your elbows straight. That's it.
He's had 3 shots and he's had one of them.
OK, what we'll do is we'll go on the next rhythm check at 13 minutes past.
The ambulance crew found the man's heart in VF, or ventricular fibrillation, which means it's quivering rather than beating. Despite using the defibrillator 3 times and administering adrenaline, it has not regained a normal rhythm.
Everybody else stand clear for me. On 1, stand clear. So 3, 2, 1, back on the chest, guys. OK.
The man is only in his early 30s. Mitch and the crew are battling to save his life. Across the West Midlands, the critical care teams are on call 24/7 for all life-threatening emergencies.
BVM. Yeah, on M-Time. M-Time on, reading at 3.0. BP systolic.
You don't know what you're going to. That's part of the challenge, is you're dealing with all sorts of conditions, environments, as well as all sorts of issues with the patient. And you never quite know what you're going to get until you get there. And it's probably the reason that most of us sort of end up in this role.
Just gonna have a little look at your foot, okay?
Nice deep breath.
Well done.
Ambulance services, the patient breathing.
She's breathing, but she's not responding.
Okay. Does her breathing sound noisy? Is there any gurgling or wheezing sounds?
Yeah, it's a gecko. Sue, are you okay?
Is she responding at all?
No, she's giggling.
Just try and roll her on her side, remove anything from under her head and just keep checking this breathing for me, okay?
Okay.
Is she diabetic at all?
No, she's got MS.
She's got MS, okay.
The woman who has multiple sclerosis is unresponsive and struggling to breathe.
It's a 60-year-old female MS patient. She's been found unresponsive this morning, vomiting and aspirating.
A local ambulance is already on scene and has reported the patient, in her 60s, is choking on her own vomit.
She is a little bit of a large lady, so they have requested an extra 2 ambulances to assist, and we've got your stuff going as well.
Roger, thank you.
It's a potentially life-threatening incident, so critical care paramedic Kerry Hemus is also en route.
We're not sure what the cause is at the moment, and the crew are having to give her oxygen and assisted ventilations. But I do carry a little bit of different kit with regards to ventilation, so maybe I could assist with that. So I'm kind of thinking that through in my head. She's apparently a larger lady, so it's not going to be as easy as just sort of popping her on a chair or a scoop and just getting her out of there.
Kerry arrives on scene. 3 ambulance crews are already there.
Hiya. Hello there. Hi all. Hello. Hello. That's fine. Yeah. Does this lady live alone?
She does, yeah.
And what level of care do you know?
Full time today, all care. She's a little bit wheezy.
62-year-old Susan has multiple sclerosis, an incurable, sometimes debilitating disease affecting the central nervous system.
What was her last blood pressure? Okay.
Susan, open your eyes for me, Flower.
The ambulance crew has cleared her airway of vomit and she has been given oxygen to assist her breathing.
Right. So what's her rest rate now?
20.
20, lovely. Bless her.
Susan, hello.
She's very warm, isn't she?
She's got fentanyl patch which was removed.
Right.
She's had 800.
So she's had it every 3 to 5 minute loops.
Susan was wearing a slow-release fentanyl patch for pain relief for an existing condition. Worried she may have received too much of the strong painkiller, the paramedics have removed the patch and are giving her Narcan, a drug that reverses the effects of opioid overdose.
She's got a lot more responsive than she was.
But Susan's breathing is still laboured and she appears confused. Kerry and the crews need to decide how to get her out and into the ambulance.
Right, are we thinking carry sheet? Do you want to get her on the sheet on the bed? If we roll her, pop it on, so slide under as much as we can, then roll her towards this way, pull it out, and then we can lower her to the floor, and then we can all just do a bit of sliding.
The slide sheets emergency teams use to move patients in tight spaces can carry people weighing up to 62 stone. Kerry coordinates the operation to get Susan out and onto the ambulance.
So if we try and concertina it from this end.
Sorry, Susan, sweetheart. Bend your legs for us, that's it, sweetheart.
Fantastic, well done.
Well done, darling.
To prevent her falling off, Susan's legs are placed in a large pocket at the bottom of the sheet.
Right then.
Susan is on the slide sheet, but getting her out and onto the ambulance is the team's next challenge.
You need to speak. Carry on speaking to us. Tell us what do you do? Where do you work? Just up the road. Doing what? Engineering. Okay.
Over in Dudley, critical care paramedic Faye Pollock is treating teenage motorcyclist Cameron following a collision with a car.
We've got everything at hand just in case we need to start helping him out with his breathing.
Cameron needs to be in hospital, but first Faye must realign his broken leg in order to ease his pain and to prevent a dangerous internal bleed.
We are all in position to give that a good pull. We're nearly ready, we're nearly ready.
Manual realignment is agonising, so Faye has given Cameron a strong painkiller and he is also taking gas and air.
Can you feel me touching you? Yeah?
The right one. Come on.
That's it, Cameron. What's at the pole? That's it, that's it.
Well done, you. Well done. Well done.
That's it, Cameron. It's done, mate. It's done.
Now the leg is straight, it needs to be kept in position.
That's it. Get ready with the pole. That's it. Yeah, pull the red now. Pull the red tab. Yeah, that's it.
Faye uses a traction frame to lock it in place.
That's it, that's it, that's it. Let's see how that is. Let's see his legs. Let's see his legs.
Well done. Well done.
Cameron, how is that feel? Is that feeling any better now?
Yeah, it feels better, yeah.
Okay, excellent. Well done, everyone. Cameron, what we're going to do is just going to roll you onto your poorly leg for just a second to get the stretcher under you. So it's only going to be for a few seconds.
Sorry, mate.
Fuck off.
Fine, we're under. Right, ready, set, roll.
That's better. That's it. That's it. It's done. It's done. It's done.
Have another suck on that, mate. Have another suck.
I know you feel absolutely rubbish at the moment, mate, but you're quite lucky that we're only dealing with your leg.
1, 2, 3.
Brilliant. We'll get you nice warmed up.
To avoid hypothermia, Cameron is wrapped in blankets and foil to keep in as much body heat as possible.
Perfect.
Looks like it's tensing up.
Now that we've straightened it up, all your muscles are all out of kilter, so it will start to spasm. 6-2, thank you.
Faye calls the trauma desk, who will inform the hospital to Cameron's arrival.
We're going to Russell's Hall, trauma tool positive stage 3, and our ETA now is probably about 5 minutes. We've alerted the hospital, so there'll be a couple of doctors waiting for us. Okay, good man. He was extremely lucky that he hasn't suffered more injuries. He could have bumped his head straight onto concrete and got himself a traumatic brain injury. I appreciate he's probably in a lot of discomfort at the moment with a broken leg. He really is perhaps the luckiest chap around today because it could have been far worse. We're here now, my sweet. All right.
Now as comfortable and stable as he can be, Faye can hand Cameron over to the waiting hospital doctors.
Just a few bumps, Cameron, okay?
9898.
Go ahead, Beck.
Evening, I am here. I have drugs, so I'm just doing the checks, but you can use me if you need me, over.
It's Saturday night, and trauma doctor Matt Rowley and critical care paramedic Becky Chappell are beginning their shift.
We've had some really busy shifts together, but we've had some quieter shifts as well, so we'll see.
Years ago, everyone would say that Friday, Saturday nights are probably going to be your busiest nights of the week, but it can be a bit hit and miss. You can sometimes have busy weeknights, but historically, Friday, Saturday night will be busier. So I think as the night gets later on, we tend to see more things happening. Righto.
Ambulance service. Is the patient breathing?
Yes.
Are they conscious?
I don't think so. Well, my husband is falling down the stairs.
Okay. How old is he?
76.
We'll come with blue lights and sirens as fast as we can, okay?
A 76-year-old man unconscious after a stair fall is an immediate code red emergency, potentially requiring urgent critical care. So Becky and Dr. Matt are en route.
Worst case is if he has fallen top to bottom of the stairs, he could have a really significant brain injury, which has left him unconscious. If that's the case, we'll assess him when we get there, and potentially one of the things that we can do is to give him an anaesthetic and to put him into a medically induced coma.
In Britain, someone falls downstairs every 90 seconds, killing around 800 people a year.
Whether it's people that have slipped, whether they've had a medical event such as a heart attack or a stroke which has caused them to fall downstairs, whether they're intoxicated and fall downstairs, it definitely makes up a lot of our workload.
Becky and Dr. Matt arrived 16 minutes after their alert.
How you doing?
Hi,
You all
all
right? What we got?
Hello.
76-year-old Joe was on his way up to bed when he fell. His wife Sybil called 999.
Joe, can you stick your tongue out for me? Good man. Give my hand a squeeze. Joe, give my hand a squeeze for me.
Joe is barely responsive and his speech is slurred, which could indicate a brain trauma.
Do you know where you are at the moment? Where are you? Say again.
Yeah.
To properly assess him, Matt and Becky need to get Joe onto the ambulance.
Right, OK.
Okay, you're just walking down it.
Joe, just relax for her. Just relax,
Okay.
darling. Have you got pain in your head?
We're going to get you in the ambulance and have a little look at you. Get you warmed up first, yeah?
Give both of your feet a wiggle for me.
It's a good sign. But Joe needs a hospital scan to fully assess if there has been any damage to his spine.
Good, well done. Let's have a little feel of your chest. You got any pain anywhere, Joe?
Joe has no obvious serious injuries, but he's confused and his breathing is laboured.
He's definitely struggling, isn't he, from a respiratory point of view?
Brain trauma remains a risk. Becky seeks clues from his wife.
Does he take any blood thinners?
I think he does.
If somebody's taking blood thinners, they're at an increased risk of bleeding. So if they have bumped their head, they've been unconscious, they've got an obvious head injury, they are at risk of having a significant bleed into their head.
All right, are you in pain, Joe?
I'm going to swap with you, so in 5 seconds, 4, 3, 2, 1. OK, jump out of the way, George. Nice one.
In a Wolverhampton churchyard, critical care paramedic Stephen Mitchell is leading the resuscitation of a man found collapsed in cardiac arrest 22 minutes ago.
That looks like VF. Georgia, can you charge the monitor? OK. Everybody else stand clear, please. OK, everyone clear? Yeah. 5, 4, 3, 2, 1. OK. Right.
The man has now had 8 shocks from a defibrillator, but his heart has not gone back into a normal rhythm.
I'm going to get the Lucas device out. Open up the Lucas device over there for me, please.
Despite being very unstable, Mitch makes the decision to move the man to hospital.
OK, so mate, do you want to sort of go the other side and feed that under his back for me?
To keep blood pumping on the journey, he decides to use a Lucas device. Only carried by the critical care team, it performs automatic chest compressions.
We're going to place that underneath him, so I need you to lift his shoulder up for me. Sit him slightly forward, so Georgia, can you support his head? And then we'll put that underneath his armpit. Slight lift. Go on, put it through, Rich, that's it. Go for it. Yeah, push it on. OK, it's about to start, OK.
Lucas device fitted, Mitch can now move the man to the ambulance.
Right, what we'll do, guys, we're going to lift either side, watch everybody's toes, just feed the trolley in. Would you mind grabbing the foot end of the stretcher? Rich and myself, we're lifting the stretcher on 3. 1, 2, 3. Dan, push. OK, push. Sit. George, get the patient on the truck for me, please. OK, ready? OK, watch your back. OK, that's VF. Charge and shock that, yeah? Everyone clear? Yeah. Shock in.
Before they move, Mitch gives the man another shock to try and get his heart back into a normal rhythm.
6-2.
6-2, go ahead, Mitch.
Mitch calls the critical care desk, who will update the nearest cardiac unit on the situation.
So, male, 30s to 40s. Currently, Lucas, he's had 9 shocks and he's in VF. He was found rather than witnessed. Received.
Yeah, thank you, Mitch.
Nice one, Rich, just nice and steady.
9 minutes later, Mitch delivers the man to hospital, with the Lucas device still maintaining blood flow round his body.
Yeah, you're happy there. Oh, slowly. Yeah, it's right. OK, got it. Oh. All right, cheers. Yeah. His heart was in a disorganised rhythm throughout, and it needs shocking all the time or special drugs, so we brought him here where we can sort of take that a little bit further. And unfortunately, it's quite cold today, and whether that's been a factor to what's happened, we don't know.
You grab that bit and then... OK. Everyone ready? Are we going onto the floor now? Happy? Just gently, does it?
In Birmingham, critical care paramedic Kerry Hemus is leading the effort to get 62-year-old Susan onto the ambulance.
Ready, steady, move. I'm sorry, Susan.
Ready.
Everyone happy?
Yeah.
Lower. If we try and lift and slide at the same time, is that all right?
Susan, who has multiple sclerosis and is also overweight, is confused and having trouble breathing. Suspected of suffering from an accidental overdose of painkillers, she has been placed onto a slide sheet and taken off her bed. Kerry now needs to oversee getting her out of the house.
Ready, steady, slide. Is everyone happy? Ready, steady, slide. Perfect.
Sorry, Susan.
That's fine, darling, that's fine. Right, we've got a little bit of a lip here. We're going to need to lift her over. So, ready, steady, slide. Right, is everyone happy? OK, we'll just go... Yeah, well, we'll go up as far as we can, yeah? Everyone happy? Mind your back.
The most strenuous part of the procedure is lifting Susan onto the stretcher.
Right, ready, steady, lift. OK, just a bit, legs on first, that's fine. And then we'll readjust. Shall we stop a second, reposition? Yeah? When you're ready, yeah? Ready, steady, move. Beautiful. Right, let's get her in the warm and then we'll reassess. How are we doing, Susan? OK.
Happy?
Yeah, happy.
There we go.
Led by Kerry, but working as one, the paramedics start their transfer of Susan to hospital.
Yeah, slippery here as well. Oh, mind your foot. That's it.
Take you to hospital, Susan. I'll write to her later.
With Susan's breathing still laboured,
There's a wheeze on the chest if you want to let them know.
Kerry travels with her in case she needs critical care. At the hospital, Susan's symptoms will be investigated further.
Right, I'll take this in with me. Her conscious level has come up and she started to respond. She's what we call aspirated, and that some of that vomit has gone on to her lungs, which is why she's wheezy. And now it's over to the hospital to try and make her better and sort her out.
Trauma doctor Richard Fawcett
gels is what it says on the tag.
And critical care paramedic Pete Edwards are preparing for their shift.
It's payday weekend, Friday night. Could expect anything. I'd be surprised if we don't go to a stabbing tonight, maybe an RTC, potentially somebody falling down the stairs. That's the sort of typical things, but it could go manic. Expect the unexpected.
Ambulance service for patient breathing.
Yeah, but it's really emergency. He's got stabbed, a massive wound, and he's breathing, and I can't stop it. You can see his stomach.
Get a dry dressing or a clean cloth, fold it into a pad and press onto the wound. How old is he?
40.
Can you try and talk to me on the phone? Hello, sir. Where have you been stabbed?
In my belly.
Have you lost enough blood to fill a coffee mug?
Oh, there's blood everywhere.
A knife wound to the abdomen could be a Category 1 emergency. An ambulance is en route, and just as Pete predicted on payday Friday, so are he and Dr. Richard.
Got reports of a gentleman who's apparently been stabbed or slashed with a Stanley knife in a pub and has extricated himself home.
Now bleeding for over an hour, the volume of blood loss could become life-threatening. As Richard and Pete arrive at the house, our crew is asked to not film inside the property.
It's like a slash. No evidence of any major hemorrhage, and it looks like it's just in the fatty tissue.
The man's wound is superficial, and the local ambulance crew has stemmed the flow of blood loss.
We're going to just load him up and get him gone. 982 Whiskey Romeo over. They're going to take him to the QE. There's laceration to the torso.
The patient needs hospital treatment, but his injuries are not life-threatening. Richard and Pete leave him in the care of the ambulance crew. It's shaping up to be a typical Friday night for the critical care team as their second emergency comes through.
Ambulance service, how can I help?
Hello, it's West Midlands Police. Can I have an ambulance, please?
Yeah, what's the reason for us attending?
We've got an RTC. One person's been ejected from the vehicle, possibly in a stolen car. He's been in pursuit.
We're over there as soon as we can.
It's a road traffic collision with the potential for catastrophic, life-threatening injuries.
The details at the moment are all very sketchy and very limited. We're only about 3 minutes away, so I'm sure we'll find out soon enough.
Pete and Dr. Richard are the first medical team to arrive.
It's clipped the van, hasn't it?
Look at that. Is it this?
Fucking hell, they've ricocheted all down the road.
Police had been trying to stop a suspected stolen car, but the pursuit ended after the driver lost control, smashing into numerous vehicles on a residential street. An officer briefs Pete and Richard on the casualties.
Is it just the one patient, is it?
Yeah, well, we've got one in our police car there who was a passenger, but he's run off and been caught in a foot chase. So our main concern is this guy here.
He's been ejected from the rear and he was struggling to get up to begin with. We've managed to keep him as sedate as possible. So he's got some visible cuts on his eyebrows.
Hi, mate.
All right.
How you doing? All right, I'm Pete, one of the paramedics. Can I just have a quick feel of your wrist, mate? Okay. Do you know what day it is?
Yeah.
What day is it?
Friday.
Let's just whip your top up, mate. Let's have a proper look at you.
The man is alert, ruling out a brain trauma, but Pete needs to assess him for other serious injuries.
You got no pins and needles or anything on you? All right.
When the ambulance crew arrives, Pete brings them up to speed as they prepare to take the man to hospital.
He's got facial injuries. The best thing to probably do is, if we just get the stretcher, we'll do all the observations and the checks in the vehicle. You say you haven't got any medical problems like asthma or diabetes? You've got a hole in your heart. So any breathing feel all right? All right.
A hole in the heart can weaken it, and the artery supplying blood to the lungs. Pete wants to get the man onto the ambulance to check if he has any internal injuries.
Can you feel me touching that? Yeah. Give me a squeeze. And this one? Yeah, all right, okay.
Right, so let's sit him forward, have a quick gander at his back.
We're going to sit you forward so we can just have a look at your back a little bit and your chest, okay? We'll sit you forward, okay? If you come forward with me, that's it, I'll keep a hold of you.
In Stourbridge, 76-year-old Joe has fallen down the stairs at home.
There, we've got a bit of an abrasion there. Joe, is it hurting anywhere? I'm pushing here. Yes, whereabouts? Tell me when it hurts.
In your neck?
I mean, there's no crepitus, there's no instability, deformity or anything there. I think from a brain injury point of view, he seems okay. He's able to talk to us and he's alert. I think we're more concerned that he's got an underlying medical problem that's caused him to have a fall.
Just leave that on, Joe. That's helping your breathing.
His work of breathing is quite hard. His oxygen levels were low, so there's a concern that there's possibly an infection in his chest.
Despite being on oxygen, Joe is still struggling to breathe.
Shall I just go and speak to wife and see what it's been like in day with his breathing?
Yeah, okay.
Right, my stuff's there if you want.
Any information Joe's wife has could help determine their course of action.
Has he been struggling with his breathing today? Has he been like breathing quite quickly and looking a bit out of breath?
Yes, I noticed it yesterday or the day before. He came downstairs and he couldn't get his breath. He was breathing, you know.
Right, OK, so he has been struggling today, but anyway,
yes.
OK. So he has been struggling quite a bit today with his breathing, quite out of breath coming down the stairs and such. So I think this is probably how he's been.
A lung infection, like pneumonia, could quickly become life-threatening. Joe needs urgent hospital care.
Do you want us to travel with you, all of us, or?
Yeah, if you don't mind.
Yeah, it's fine.
In case Joe's condition worsens, Becky stays on the ambulance, ready to provide life-saving treatment.
So was he initially unconscious, completely unconscious?
He was conscious throughout with us. His wife says that she's been conscious throughout with him.
Joe arrives at hospital, where any internal injuries and his difficulty breathing can be investigated further.
What we're going to do, we're going to get a stretcher here.
Yeah.
We're going to get you onto it, all right?
Yeah.
In Wolverhampton, critical care paramedic Pete Edwards and trauma doctor Richard Fawcett are on scene at a road traffic accident involving a suspected stolen car.
Don't move your head. Have you got any pain in your neck or anything?
A passenger who was thrown through the car's back window and onto the road hasn't moved since they arrived.
Okay. Definitely no pain in your legs, nothing? Sure, moving all right?
You can get up.
All right, okay.
Having found no evidence of serious injury, Pete decides it's safe for the man to stand up.
Okay, nice and steady. Just sit forward, right? Just nice and steady. No pains?
No, nothing.
All right then, mate. Come and sit on here then, yeah. Pop yourself on there. Swing your legs up.
Further back.
It all seems to be facial injuries. You've been lucky, mate.
Incredibly, despite his ordeal, other than some cuts, the man appears unhurt.
He should have some major injuries, but actually he's remarkably uninjured. Very lucky, extremely lucky. When you look up the street and see the damage to the cars, you'd expect some serious injuries, but yeah, nothing. Nothing major at least, anyway, which is a good thing.
It's 5 hours into Richard and Pete's Friday night shift.
On to the next.
And their third emergency call is coming through.
Ambulance service, can I help you?
Hi, can we request your attendance, please?
Yeah, are they conscious and breathing?
We've got a vehicle that's gone into a wall. I think there's a number of people in the vehicle, not just one.
What's the vehicle hit, sorry?
It's hit a wall. We're currently requesting fire as well, because it sounds like potentially they're stuck in the vehicle. They're trying to get the female out of the rear, and she's screaming in pain. The engine has come out of the vehicle, so it's going to be very high impact. I'd be surprised if there wasn't any injuries.
Sounds like there's maybe people trapped inside the car, so either they've sustained serious injuries and they can't actually get themselves out because they've got broken bones, etc., or the impact of the crash has caused the metalwork to crumple and physically trap the patient inside, or a combination of both.
It's another typical post-midnight road traffic accident, and all 3 emergency services have been called to the scene.
From both ends of High Street.
Firefighters are trying to free a trapped passenger. The operational manager briefs Richard.
Female still in the back. She's got apparently some neck pain. The driver apparently has walked off, so unknown where he is at present, and they're not being very au fait of who he is and where he is.
The car has come around a bend, veered off the road and hit a stone wall.
A heck of a whack, isn't it?
Yeah.
The high-impact crash demolished the front of the vehicle, dislodging its engine and throwing it clear. The driver has disappeared, and the woman left trapped inside has just been freed, so Richard can assess her. She's traumatized and in pain, but Richard's satisfied the woman has no life-threatening injuries. It's the second remarkably unscathed passenger involved in a major car crash that Richard and Pete have had on their Friday night shift.
Not really got any apparent obvious significant injuries. It's just complaining of some neck and back pain over.
Fortunately for this individual, they can leave her in the care of the ambulance crew, who will take her to the nearest hospital.
It's quite a lot of damage to the front of the car, but actually the crumple zones have absorbed all the energy, and the actual part of the car where the passengers were sitting is actually undamaged. So they've got away with it really, done really well. It's got a shoulder injury, but otherwise seems uninjured with what could have been. She's got off lightly, so we're not required. Ambulance crew more than capable and happy to deal with that.
As Pete predicted, it's been a busy payday night shift for the critical care team.
We've done the stabbing, 2 RTCs, which is a pretty regular weekend night.